So I'll be giving a perspective from a ambulatory pediatric office that will apply for some of you, not all of you, but we're all preceptors, and it is difficult sometimes to integrate students into your busy life. And I do have some photos in here. I hope they're not offensive. I hope you find them entertaining. My 9-year-old daughter helped me pick most of them, so they're pretty clean, and I think you'll enjoy them. But and hopefully you'll gain some insight, and hopefully you won't look like the guy on the left there with when you have students coming to your office. I'm sure all of you enjoy teaching and find it as rewarding as I do, and hopefully this talk will help you make it a relaxful, rewarding experience next time a student comes into your office. So as preceptors, all of us have barriers that we have. The main thing is time. If you talk to preceptors that don't take students, the most common reason for them not taking students would be they simply don't have time. And there's a perception out there that precepting a medical student is equivalent to a decrease in your office efficiency. And there's some data and some studies to support that it'll add approximately 45 minutes to an hour of time to each day that you have the student. However, I'm going to show you some tricks here that maybe can cut down that time, and some other techniques and some ways that the student can be looked at as an asset rather than a liability here. And again, we're here to acknowledge also preceptor has to share their time with not only the student but their patients, obviously, and practice productivity is important as ever right now. So you have to find a way to balance those three things and practice good medicine at the same time. And then, of course, the next slide here also mentions some other barriers. As you know, medicine's moving towards a value-based reimbursement model from a fee-for-service model. And this is just giving doctors more work to do in the same amount of time. And if you're a student in the mix, it just makes it even more difficult to be efficient sometimes. And then most importantly, as a physician, is your physician-patient relationship. And somehow we have to find, as preceptors, a way to incorporate students into our practice without damaging that relationship and hopefully fostering that relationship. So I divided this talk into three steps for incorporating students into your practice successfully. And it's all about preparation, like many problems that we encounter in life. Preparation of your office staff for the incoming students. Preparation for the student themselves coming into your office. They're going to a new rotation every 6 weeks, new environment, different preceptors, different expectations, different patient population. And your patients as well, preparing them for students. And the next slide here tells some ways you can prepare your office for incoming students. Scheduling is really going to be preceptor dependent. I myself don't use any specific scheduling pattern. There's a wave scheduling pattern in which the student sees a patient, you see a patient, then you have the student present their patient to you. And while they're writing up their report, you see a third patient. So you're seeing sort of 2 to 1. Some physicians may double book their schedule. They may put more patients in the beginning of the day to leave time at the end of the day to do more mini lectures or other type activities. But the wave scheduling is one method. But I think it's really important. You're a preceptor, but so is your whole office. And it's really important to get your entire staff involved. Because someday these physicians are going to be in an office setting, and they need to know how practice functions, not just seeing patients. They need to know a little bit about the business aspects, so if they could speak with billers, even the secretary, how scheduling is done, how appointments are made, and the nurses, of course, what they do, and utilize your office manager. They know the office, the whole structure, and they can give a bird's eye view to the student. And I think it's really important to really welcome them with open arms and make them feel part of the team. Like I said, they're going every 6 weeks to a different location, and some of them are a little bit uncomfortable. So it's very, very important to take them with open arms right off the bat. As far as preparation for your patients, there's different ways of doing it. You don't want to blindside your patients and just have a student open the door one day and say, I'm here to examine you. Some patients may be turned off by that, and it could damage your physician patient relationship with that patient. So there's different ways of mailing letter to your patients, telling them that you're accepting medical students. You can place posters or even pictures of the student that's currently in your office in the waiting room, and maybe a bio on the student so they can learn about them before they see them. And it's really important how the office staff ask permission for the patient to be seen by the student. Like many things, if you ask a certain way, if you make it hard to say no, if you sell the student, they're more apt to say yes rather than giving them a leeway or give them a way out of not accepting the student to see them. So, really talk to your staff and have them introduce the student as a positive thing in the office and talk them up and basically tell the patient too they have a unique opportunity to be a teacher and teach some of the area's finest future doctors. And some patients, I don't have any problems in my practice that much with refusals, but I know there are some populations that sometimes want to see the, quote, real doctor. But as far as preparing the student for the rotation, this is just a mini checklist that I prepared. Obviously things like reviewing the arrival time and introducing staff members and a tour of the office. Sometimes it's helpful to have the student go through the office as an actual patient so they see the office flow and get a good idea of what it's like to be a patient in the office. And I think every student should have their own dedicated space in your office, not just for their lunch, but maybe to do some writing. And obviously they should know where, if you have any medical books or learning resources, that should be taken care of. And I want to emphasize that orientation doesn't have to occur the minute the student comes in. The last student that came to my office came in Monday afternoon, and I was slam busy. So I told them point blank, we're going to have an orientation at the end of the day. And you don't have to do it all in one day, but this is just a rough checklist of some of the things that I think are important. Obviously, every practice is different, so you have to review with the student the types of visits you have, the patient volume, and the scheduling of your patients. Review your medical record. We're now electronic medical records, so it's important, I think, for them to see what I'm seeing on the computer screen and review the parts of the PE that you'd like them to do on a regular basis, as well as I have written templates of my sick visits and well visits. When I wasn't electronic, I had them carry those around and use those for their documentation. I also inform them how to present their cases, and the SOAP format is pretty much what I use for routine visits, as well as make sure that they have all of their papers ready. And for each rotation, it's different. For pediatrics, they have to finish certain required forms, such as an oral presentation or observed physical exams for neonates as well as children over 2. And you don't want to leave those to the last minute. And scheduling dates for the midpoint as well as the final evaluations are very important as well. You want to give them feedback in a timely manner and definitely have an end of rotation evaluation with every student. As far as list of objectives for the rotation, you not only want to provide your list of objectives, you want to ask them what their goals are, and you want to see what their baseline is. Which rotation did they just finish? What are you working with here as far as a starting point with the students? You don't overwhelm them, or some students you can start at a very high level teaching them, and they can add a lot of efficiency right off the bat to your practice. So I tell students to bring a lunch if possible. Other doctors, they may go out to lunch. That would be a good time to discuss topics as well. But in my office, I eat lunch in the office. But that's a good time, even 10, 15 minutes. You can fly through a topic or talk about the morning patients. I find that very helpful. And I'm a big believer in writing notes. I'm very into technology and consumer electronics. However, I still carry a notepad around myself sometimes and write pen and paper. I think there's something to be said about that. And have them write down notes pretty much on everything. And I tell them when I'm in the room, write that down. That's important. And we'll get to that later in here, mentioning about the notes. So different teaching techniques you can use in your office. I find it helpful. I've always had a morning huddle sort of with my staff, just reviewing the day and sort of sets expectations for the day. I'll ask the student too, do you have anything that you have to do? Do you have to leave for a lecture? Usually those are planned out in advance, but sort of set goals, whether or not we're going to try to get the student to do a full physical on that day, or what types of patients we have coming in so they can read about certain cases if possible. And I like to ask them at the end of the day, what did they learn? Not only to make sure that they're learning, but to make sure that I'm teaching. It's also a reflection on what I'm doing. So I find that helpful. And again, mini lectures discussing cases during downtime. I think it's very important to have a list of topics rather than saying, oh, we have some time. What do we want to talk about? And I keep a list in my office of common pediatric problems that I review with students if we have time. And in summertime, it gets very slow, so we have a lot of time to go over topics, and we have them readily available. So you can assign students to do topics and learn from the student as well. That's another way of them learning. But majority of the teaching in my office is in outpatient office will be experiential. Everything is new to them, especially pediatrics. A lot of them don't have kids. They don't know a lot about kids. They're afraid of kids when they're crying. I mean, so I teach on the fly a lot, and that's why I think you could get a lot of teaching done if you're in an ambulatory environment. And there's really three methods here of teaching on the fly. First one is more of an observational method. Shadowing, sometimes referred as modeling, and then seeing the patient together with the student is another type. And obviously then the student themselves can see the patient independently, and they can do that and then report to you, and then you can return and finish the encounter with the student and the patient. That's the conventional method. I'll show you a different way of doing that. As far as the observational mode, this will give the student a good idea of what the office flow is, what interviewing techniques you like to use, your interaction with the patient, the family. This is very time efficient. I sort of like to use this early on when the students first come, so they can see how the office flow is, how long I'm in the room, what kind of questions I ask, what kind of a physical examination I do on a pediatric patient. And this is a very time efficient method. It's very non-disruptive to your office flow, and this is sort of a default for many physicians because it really doesn't slow them down that much. And it definitely has its place for emotionally sensitive visits like delivering bad news. You don't want the student to have to be the one to do that. The disadvantages are sometimes it can lead to boredom or passive learning. So ways to promote active learning, and when the student's shadowing you, I like to use talk out loud a lot. And basically, this not only helps the student telling you what's going through your head, why you're doing what you're doing, why you're not doing what you're not doing. You're not going to order tests because of this, but you're going to follow this management plan because of X, Y, and Z. And I think this helps validate your plan to the patient as well. And it educates them, and they can leave your office with an understanding of what's wrong with them and why you did what you did. So they don't leave the office saying they didn't do anything, or they don't know why you didn't do anything, or maybe you did something and they need to know why. So I find that very helpful. And again, I can't emphasize in my office, I love them taking notes through the visit. And if I see that they're not taking notes, I'll ask them sometimes at the end of the visit, can I take a look at your notes? What did you write down there? What did you learn? And in a nice way, but it just shows you that you're watching them and keeps them engaged. As far as seeing the patient together in the room, there's many different variations. Probably the most efficient one that I've done and that the students, when I ask them what they like, is the first one here where just imagine we open the door, the patient's there, the student asks permission to do a quick physical on the patient. And usually the patient's sitting in the mom's lap, if it's a small one, or sitting on the exam table while I do the HPI. And usually there's enough time with me doing my HPI for them to complete a physical exam. And many of them say they don't get the opportunity to examine enough children during their first and second year, so they really enjoy that. So I tend to use that technique quite often. You could do it reverse. It would be kind of awkward for me to do the physical and have them do the HPI, go right to the physical first, but certain scenarios, I think that's totally appropriate. And then you could have the student do a full H&P and presentation in front of the patient. Again, that's time-consuming, but there's definitely a place for that as well. And again, during any of those scenarios or any other scenarios that you wanted to make up, you can also do the talking out loud and direct questioning of the student, keeping them engaged, make it a dynamic learning visit. And again, the student note-taking as well during all of this. So as far as presenting in front of the patient, there are certain advantages. You can teach the patient and the student simultaneously, and you can see how the family reacts to the student and the student reacts to the family. You can't see that aspect when they come to your office and report the history from the patient. You miss that. And you can point out important physical findings. You can teach interviewing skills on the spot, so you can provide instant feedback. It's very, very useful. Probably the most common tool for case presentations and very efficient is the 1-minute preceptor. I'm sure many of you are familiar with that. And these are the 5 steps of it here, where you get a commitment from the student, ask them what is going on, then you ask them why they think that, what's their differential diagnosis, and then you try to provide them positive feedback, review things that they did well with that patient, and maybe show them some ways they could have approached this differently for future encounters. And it's a great learning experience for them. And you don't want to throw too much information at the students. If you can teach them one general rule, typically something that they can use in the future to apply to other clinical cases, that's all you really need to do. They don't need to know everything about every case. The 1-minute preceptor, I think everyone does that probably, and you don't even know you're doing it. It's a very good tool. So this is another tool for patients seeing, the student seeing the patient by themselves. This is referred to as priming. I use this a lot as well, where you supply background information and some knowledge to the student before they go into the room. You give them strict directives. You can even give them a time limit. I'm going to come back in 10 minutes and pull you out of the room, see what you could do. And I use this a lot also for, we have lots of questionnaires that I need to fill out. I do a lot of work with obesity. I have obesity questionnaire I give to a lot of my patients for their follow-up, or other chronic problems like asthma. All my asthmatics get asthma control tests. And that's where I can utilize the students to come in there. They have to be answered anyway. And rather than me going through the questions, it's much more efficient for them to get that information for me. And I have my own focused HPI templates that I originally made for my EHR Cerner, but I've found a good use for them now with the students, and I'll show you some examples of that. And this is one for headache. So this is an auto text I have in Cerner, but say a patient comes in with chief complaint of headache. I can have the student go in with this template, and this is valuable information for me, and the student is learning a focused HPI type learning as well. Sometimes, obviously, you don't want to give them the HPI in a platter. You want them to struggle and try to have to filter through all of the information that the parents are throwing at them. But this is an efficient way of them learning and you getting the needed information. This is the one I use for adolescents. This is the HEADS Adolescents HPI. All my adolescents get this. And we've talked a bit about what we can do as preceptors here, but what can the student do for you? So how can you utilize your student to make you more efficient? And I think here's a couple things I jotted down. First of all, in pediatrics, we definitely always need an extra pair of hands. Kids do not cooperate. If they see a vaccine coming their way, they're going to fight you. And it's human nature. But just for holding, they're helpful. Sometimes you need them to go get the nurse for you. Simple things like that. Also, I use them sometimes for simple procedures. I hope I'm not in violation with anything with this, but this ear flushing fluoride varnish application, I'm supervising them, and I can write up my HPI while they're doing that, and they feel like they're being helpful, and they are. Also, when I get very busy, sometimes I'll send them out in the waiting room to bring the patients back to do their vital signs, and I think the patients like that. I mean, most of them are on their smartphones anyway. They probably like live entertainment, I would think. They used to like magazines, but they don't like those anymore. It's all the smartphone. But, as far as utilizing them for reviewing medications, I do that a lot as well. They can teach patients how to use their MDI with spacer if they're asthmatics. That's all important information that's time-consuming, that has to be done, that they can do a great job. You just teach them once or twice how to do it, and they can do it in the future. They can also develop patient education plans. You could utilize them in that way. And again, with the quality measures that I mentioned earlier, you can utilize them to help knock off some of those measures you have to do anyway, all of those questionnaires. And sometimes I have them play with the kids and just do hands-on developmental screening. And I think they learn their developmental milestones very well that way as well. So, and I had one student actually who really helped me on the last one here with conducting a complete psychological evaluation. I had a teenage female who was just wouldn't look me in the eye, came in for fatigue, non-specific complaints, was clearly depressed, and would not talk to me. After 30 to 45 minutes with a female third-year medical student who was interested in psychology, she was laughing, giggling. She wanted to Facebook the student, and apparently she was having problems with her boyfriend, and obviously she didn't want to talk to another man. So, but you can utilize students that way, and that was invaluable, and there's no way I could have spent 45 minutes with that patient. The patient needed help right away as well. So. And I think when we utilize students here to perform tasks that can make us potentially more efficient in the office, I think it's a very rewarding experience for them. So many rotations, they feel like they're in the way, they're obstructing the office efficiency where they're going. When they feel like they're part of the team and they're helping you, you can see it in their eyes that they really feel that it's a rewarding experience. So, and they feel like they, can give something back to you, because I think they really do appreciate us and what we do. So, in summary here. Hopefully you can see here that preparing your office practice, your patients, your students as well, are essential steps in implementing medical students into your practice. And there's really a variety of different teaching methods you can use with students in an outpatient setting. I'm sure there may be some other ones for inpatient setting. And you can choose which one's best based on your time available, patient factors, students' needs at the time, and their level of training. And hopefully I've shown you that students can perform tasks that can really save you time and benefit your practice. And that it is possible to construct a win-win environment for the student, patient, and your practice. And that's all I got. And hopefully that was helpful for everyone.